The fight against heart disease begins with preventative screenings available right here in our Cardiovascular Health Institute.
We're going to be doing an EKG, we're going to be drawing some lab work, we're going to be getting a chest x-ray.
We offer a series of advanced heart screenings that can discover life-threatening issues before they develop into real problems.
Every test you're having done here today is going to tell you everything you need to know.
It is well known that if you screen patients, you can capture a lot of illnesses that they don't have symptoms. So by screening them, they will know about their illnesses more. They can communicate them with their primary care physicians.
Our expert team can advise you which of these screenings are right for you. Our comprehensive heart risk assessment provides a clear picture of your heart's health. Other screenings include testing for atrial fibrillation risk, sudden cardiac arrest, and vascular screening.
Where you can come in and have your risk factors assessed, your risk for myocardial infarction assessed. And if you go to the next level, if you do have risk factors or symptoms, then you go through the system. You might get a treadmill or a stress echo. You might get an angiogram to see what's going on, or a CAT scan, or a calcium score. All of these are available here.
Prevention program at Tri-City Medical Center Cardiovascular Institute assist patients to prevent major illnesses and allow them to take charge of their health.
He'll be having an EKG, and he's also having a quick look echo.
Whether you are here for a screening, registering for an inpatient procedure, or to support a family member or friend during surgery, our focus is on your well-being.
When a patient comes to the Cardiovascular Health Institute, they'll be treated like family. My role is to make sure that they are not worried or stressed, that they feel comfortable, informed, and I make sure that as soon as I know anything, I will let them know, and we just have a safe place for them while they wait for the results.
Well, hello, Mr. King.
Hello.
Hi, my name's Lydia. I'm your clinical care coordinator. Families will come in with the patient in the mornings, and you're able to stay with them during their pre-op. And once the patient goes into surgery, then the families will come here and stay with me, and we will be together for a good 3 to 4 hours.
Our clinical care coordinator will make sure you'll receive superior care before your surgery, during your surgery, and after you go home.
I spoke with Dr. Folkert, and he has even 30 days after you leave the hospital, I'll be calling you at home too, just to coordinate all the care that you're going to need.
When a patient is undergoing a procedure, the surgeon will explain the procedure to family members using the latest advanced technology.
This is your mitral valve on this screen here, and that's the blood leaking back into the left atrium. And over time, that will make your heart fail.
A personalized approach to care at the Cardiovascular Health Institute enhances healing and advances your health right here in your own community. Our experienced physicians will guide you to the right treatment plan and show you less invasive techniques to fight heart and vascular disease.
We have cardiac surgeons, cardiologists, vascular surgeons, and vascular and interventional radiologists, sort of the 4 pillars of medicine that take care of most vascular problems.
Tri-City has a great facility in which for you to have your operation. The people are fantastic. They care about you. They'll provide you with individual attention.
We need to get you with a surgeon and talk about having a mitral valve repair or replacement. So we're going to use a heart team approach to deal with Mr. King. We have advances here in our cardiovascular surgery program, and hopefully we'll be able to use those advances to advance his health.
We've got the people who are best at each thing doing the things that they're best at, and overall that results in the best outcome for the patient.
I've been quite pleased with the kindness, the knowledge, their concern for my well-being.
We offer a range of innovative diagnostics and surgical procedures, including robotic heart surgery.
At Tri-City Medical Center, we have the latest iteration of the Vinci surgical robot, which allows us the ability to perform cardiac operations through a much smaller incision, allowing patients faster recovery times and return to their normal activities in a much shorter time frame.
The Vinci robotic system turns bypass surgery into a minimally invasive procedure, resulting in less damage to muscles and organs.
When you have an isolated problem like you have, and we know that your coronary arteries are normal, that there's nothing else wrong with your heart, but except for this one problem, we can specifically target on that by going through a smaller incision on the side.
I just had a small incision right here about that long, and as far as I know, I'm completely recovered.
Our skilled surgeons also combine other new technologies to assist with heart surgery, including beating heart or off-pump surgery, and minimally invasive procedures for mitral valve.
Good afternoon, 2197. This is Tri-City at 1419.
On board, we have a 60-year-old male patient. Chief complaint is going to be sudden onset chest pain.
When a heart is under siege, every second counts. Our team utilizes the latest imaging technology for rapid diagnosis of cardiovascular issues.
The door-to-balloon times are critical because they are a reflection of your patient care. So if you're having a heart attack, your artery is closed, the muscle is dying, it's like having a string tied around your finger is turning blue, you need to get that string off, you need to get the artery open.
Took me immediately into the cardiac catheterization lab and put a stent in my heart. The doctor showed me what my artery in my heart looked like, completely blocked. It was 100% blockage, and what it looked like after he had performed the stent, and it was 100% open.
Our door-to-balloon time here is under 70 minutes, so it's really quite good by national standards.
It was really a miracle.
People recovering from heart attacks, cardiac surgery, angina, or heart failure can build up their hearts here at the Cardiac Wellness Center.
We know that exercise is going to benefit their heart, prevent future events if we can get them to a certain target heart rate, certain exercise level that will help prevent future cardiovascular events.
This is not an ordinary gym. The Wellness Center offers a medically supervised, monitored exercise program in conjunction with nutritional counseling and health education classes.
Today we'll do exactly what you did last visit.
The beauty of our program is that you have a physician on site, you have registered nurses, and you have exercise physiologists.
Program participants are monitored with state-of-the-art telemetry equipment.
When you've had a heart attack, every time you feel a little twinge or a little pain, you worry that something else is going on, and when you're here under the monitor, they tell you exactly what's happening.
We're looking to see is there any signs or symptoms that it's not getting enough blood flow. If they're having symptoms, to let them know that, you know, how things look, checking their blood pressure while they're exercising. And then every time they come in, we're slowly but surely advancing what they're able to do.
They monitor very closely. They wouldn't let you go over what your target heart rate is. But they're encouraging you to get to that target heart rate because unless you do, your heart's really not going to improve.
Our Cardiovascular Health Institute brings a new era in heart and vascular care, offering cutting-edge medicine and a well-coordinated patient experience.
Everybody's been so nice and kind, and I'm just thankful that you have a good team of doctors here that work together and care about patients.
And we're quite thankful that Tri-City is here, so close to where we live, to treat us when we need them.
I'm back to full health.
Personalized care, advanced technology, and world-renowned heart specialist. Our team at the Cardiovascular Health Institute is committed to advancing your health, advancing you.